All right, and what is your first name, sir?
Randall Denny,
Randall. Where are you from? What city?
Sarnia.
Excellent. What kind of problems were you having before you came to see us?
I had knee problems.
Knee problems. And how bad was it?
Severe enough that was painful.
Pretty
Really
bad?
pretty
Affecting
bad.
you on a daily basis?
On a daily basis, I mean, every day was
Yeah.
a chore.
What about stairs, stuff like that? You ever
Stairs,
had
going
time?
up the stairs was difficult. Going down the stairs, not so bad, but going up the stairs, very difficult.
Okay. And let's see now, you've had this treatment that was done, what, 5 weeks ago?
5
4
weeks ago. 5 weeks ago.
What kind of changes have you noticed?
I noticed as soon as the injection came that it wasn't immediate, but I could feel some relief, put it that way. The next day was awesome.
Okay. Now, what kind of percentage improvement have you had so far?
I would say my left knee, or my right knee, I should say, was about, I would say about close to 90%.
90% on the left knee.
And my left knee was only about 65% freeze pain.
So 65% on the left knee, 90% roughly on the right knee. It's
Yes.
been about 4 or 5 weeks, and
Yep.
we know we still have months yet for you to continue to heal.
Yeah. And I notice I'm walking on concrete floors. I don't feel the pain.
Wonderful.
And when I said climbing the stairs, I don't feel the pain. And I noticed that I don't try to run, but I try to increase my gait. And I find that it's not hurting at all.
Awesome. That's great news. I appreciate you sharing this with us. Thank
You're
you so
welcome.
much. All right, can you tell me your name and what city you're from?
My name is Mike Lysak, and I'm from Hadley, Michigan.
Very good. And obviously you brought your wife in here, and what kind of problems was she having?
She had a torn meniscus, and she was having a real big problem walking. She had hurt it when we were gardening. She twisted, and it was really a bad hurt. I had to actually put her on a wagon and carry her into the house. We went to get some MRIs done, went to a knee doctor, and they said that she would need a full knee replacement. And I says, that's not really what I want to do. I want to see somebody else and stuff. So I seen this on the internet, your advertisement, and we called, set up an appointment. We talked about it, and we decided we were going to go with the procedure with the stem cells, and we had the stem cells, and now about a month and a half later, she seems to be walking around with hardly any pain at all. She's doing really well.
Only so right now it's a little bit bother me. Stand cooking, stand too long in one spot, and bother me. It's really hard, step, I have to move around and loose. I go shopping with him. He look around in that stands no good. I'll be back, I walk in the shopping center, round, and then come back in, Otherwise, no problem here.
What percentage improvement would you say she's at right about now?
I'd say about 90%.
About 90%.
90%
And it's
better.
still early. We know that it's going to continue as well, but you're already seeing some massive changes, so that's fantastic. I'm really happy for you. Thank you for sharing this.
Okay.
Is there anything else you want to add to this?
No, we're good.
Only the problem is go upstairs. I
Yeah.
can use go up. I go up, this leg go up first, go down, this leg go down first, I still have to watch in a step.
Sure. Is it getting easier though now compared to say 2 or 3 months ago with the stairs?
Oh yeah, it's easier.
A little bit or a lot easier?
Lot.
Very good.
I can do, this kind of legs. Other day I go outside playing my car, and he said, where you been? I said, I play my car leg.
All right, very good.
She was so worried about getting the total knee replacements and stuff, and I told her, I says, if it was me, I would try something else. It may be expensive, but to me it was well worth it to still have your own knees and be able to move and get around rather than going through an excruciating knee surgery and then all the physical therapy and stuff you're going to need after that just to get back to normal again. People are saying it takes about a year for you to recover, and here it's only taken us about a month and a half or so, and
you're still
we're good.
regenerating too, and it's still going to improve. So I really thank you very much for sharing your story. I know people appreciate hearing this as well too.
I really appreciate it, you helping
thank you.
me. It's really nice.
Thank you.